Now, like the rest of the nation, Ohio appears to have put the most recent surge behind us. New cases and hospitalizations are at their lowest levels since last July or August. But as we have seen the pandemic, COVID-19 has a real habit of throwing us curveballs. And so, even as we breathe a little bit easier here in Ohio and across the United States, we also need to keep a close eye on events around the world. Our experience with previous surges has shown us that what's happening in Europe or in other highly developed nations has often been instructive and offered us insights and lessons for right here in the United States. Now, in much of Europe, the Omicron wave actually hit them after it hit much of the United States, including Ohio. Fortunately, some in Europe, including the Netherlands and Denmark, appear to have passed their Omicron, and they're now declining. But while our Omicron surge was primarily driven by a subvariant known as BA.1, theirs has been largely driven by a later subvariant known as BA.2. But whether we talk about BA.1 or BA.2, we're talking about Omicron. What we've learned from our European counterparts, especially in the Netherlands, is that while BA.1 are closely related, BA.2 seems to have an edge on its cousin BA.1 in terms of being more contagious. Nevertheless, they seem to have similar severity, be similarly responsive to vaccines, and very importantly, it's rare to see a BA.2 infection after a BA.1 infection, which means immunity to BA provides good protection against BA.2. So, what's the dynamic of BA.1 and BA.2 here in the United States, which, unlike much of Europe, endured a massive wave of BA.1 before the arrival of BA.2? The CDC tells us that across the country, as BA.1 is fading, BA.2 is assuming a growing percentage of the declining of Omicron cases. To use a baseball analogy, BA.2 is playing cleanup, but probably won't hit a home run. In Ohio, we haven't yet seen much of BA.2. Our most recent fairly complete genomic data from clinical cases dates from January 7th to March 8th and shows that only about 2% of Omicron variants were in fact BA.2. Likewise, looking at results from our robust wastewater testing program, BA.2 has been found in only a few of the 74 watersheds where we collect samples. Having said that, preliminary data from the last few days do indeed suggest that BA.2 percentages could well increase in the coming weeks and months, just as we're seeing across the rest of the country. Nevertheless, it's important to understand that because BA.1 and BA.2 are so closely related, there's good reason to believe that we will not face another BA.2 surge like the one we had with BA.1. Again, to use our baseball analogy, even if BA.2 were to hit a home run, BA.1 has before BA.2 even came up to bat. Now, whether it's BA.1 or BA.2, vaccines remain our best bet for safely shielding ourselves from severe disease. According to a CDC report released Friday, during this most recent surge, adults who were fully vaccinated and boosted, meaning they had had 3 doses of an mRNA vaccine, whether Pfizer or Moderna, they were 94% less likely to be put on a ventilator or to die of COVID-19 than those who were unvaccinated. To put it another way, The CDC reported that among people ages 12 and older, those who contracted COVID-19 in January and were unvaccinated were 21 times more likely to die than those who were fully vaccinated. Those are startling numbers, and they serve to underscore both the efficacy of vaccines and the urgency of making sure you're getting vaccinated and keeping up with your boosters. Now, I've mentioned before that the mRNA vaccines, and particularly the recommended third dose or booster dose, appear to prime the B and T cells in our immune system that help provide us with more long-lasting protection against severe illness. These cells aren't great at keeping us from getting infected, but they're very good at keeping us from getting severely ill. As we look at all these reports then, what really emerges is that our vaccines have illustrated and reinforced just how important immunity is in helping us weather infection, and that the best and safest way to assure our immune systems are well prepared is to be vaccinated. Now, in Ohio, 66% of those who are eligible for vaccines have started their vaccine series, and 61% have had 2 doses. That means about 1 out of 3 eligible Ohioans remain without the benefits of vaccination. And millions of others, especially those who are of more mature years, are missing out on the further benefits of a booster. So there's more work to be done to get the facts out about vaccination so we can help more people weather whatever COVID-19 storm awaits us over the horizon.